All right, welcome back. I want to get more on South Africa's war against COVID-19 and how this country is faring. Let me bring in the chairperson of the Ministerial Advisory Committee on COVID-19, Professor Salim Abdool Karim. Professor, it's a pleasure having you on the program. A very good morning to you.
Very good morning to you and all the viewers.
It's a critical time in our fight against the virus, would you say?
I think we've been going through a period where we have seen a very steady increase in the number of cases, and that's really just due to an increase in testing. So the overall proportion of our tests that are positive has remained pretty stable over the entire period of the lockdown to date. I think the big issue is going to be that when the lockdown ends, we are going to be mingling more often, and so we can expect that there will be more transmission of the virus. So yes, we are going through that period, and what we do now will determine whether we undo all of the good work that was done during the lockdown, or whether we, in a systematic way, can get back to work, back to school, and begin to capture back our lives as much as possible, given the circumstances.
So I want to get a bit more on these numbers, your read on these numbers, and maybe allay fears or put in some sound advice for our views out there. We learned yesterday that South Africa had an increase of 297 cases from the previous day. On Wednesday, there was an increase of 354 cases from the previous day. And that was the highest number of cases in a 24-hour cycle recorded to date. To a layman like myself, that's alarming. Is it to you? Are you concerned? How should we interpret these numbers?
So it's not a concern at all. I think the public has gotten used to the idea that they should look at the number of cases each day. In the initial part of the epidemic, that makes sense. Because you're looking at very small numbers and you're looking at a very early growth, and where our testing is pretty stable. The situation now is completely different. Now we have an established epidemic. We're no longer in that initial period, and we are increasing our testing almost exponentially. It's doubling every week. So if you take yesterday, when we had just over 200 cases, remember it comes from over 10,000 tests.
So it's all relative.
Compared to 3 weeks ago, when we were doing 2,000 tests. So to me, it's more worrying when we have 10% of 2,000 tests versus 2% of 10,000 tests. So the proportion, because remember what we're talking about is what is the proportion of our population that may have this virus. And remember, there's a big change, and that change is in where the samples are coming from. Until the 7th of April, we were only collecting samples at our hospitals, our clinics, and our doctors' rooms. And so what we were seeing in that time is what is called passive case finding. As we wait for patients to get sick and come to us, and then we test them. On the 7th of April, we launched our active surveillance. Now we are going in the communities. There are over 30,000 healthcare workers that are going house to house. And in our most vulnerable communities, they are screening and testing. And they are testing thousands every day. So if we do not see the numbers going up, then we're doing something wrong. So the fact that the numbers are actually going up in keeping with the number of tests, then we're okay. And so that's what you should look at. How is the number of tests changing, and how is the number of cases changing, and what proportion that comprises?
All right, so that I guess puts into perspective, puts into context what we're dealing with here. We are currently on level 4 of the lockdown, Professor. We are beginning to reopen the economy gradually. We're told that the virus is still going to be active in the next 6 to 8 months, maybe beyond. if we move too fast, we risk rapid infection. If we move too slow, we prolong the economic downturn. So moving forward cautiously, I guess, is key. Practically, though, how will this be assessed? What is the threshold? Is it a formula-based system or not?
So there is some set of criteria that are being used. I'm not familiar with all of it because it's actually not determined purely on the basis of health criteria. There are many things that go into these decisions. But I can tell you that as we reflect on where we are in the epidemic, we are now in that phase where, with the easing of the lockdown, we should expect to see an increase in the number of cases. So that's the first thing. People shouldn't get concerned about that. That is what is going to happen. We should expect it, and it is no cause for concern at all. The second thing that's going to happen is that we're going to see small outbreaks. You might recall I talked about the flames. There's going to be flames, emerging here, there. And so once you ease the lockdown, we are going to see small outbreaks in hospitals, in shopping malls. We're going to see it in schools. We're going to see them everywhere. That's not a source of concern in that we are expecting that. That is how this virus spreads. We have to now deal with the flames. Not to stand back and say, oh, panic, we got flames. No. We have to tackle the flames. And we tackle them in a systematic way. We know the tools that we have. And we go in and we sort it out and we carry on because it's going to become steadily more frequent. And it has to be. That's how the virus is going to spread. Then we're going to get to a critical point, which we call the inflection point. At that point, we will see a rapid rise in the number of cases. And then we'll have to decide what is the set of strategies we want to use at that point. Remember, we cannot avoid this epidemic. I tried to explain that very carefully. We're just trying to flatten the curve. In other words, we're trying to spread out the infections over a longer period. And we hope through that our hospitals and our clinics and our doctors will be able to cope.
Right.
And so we will keep the number of deaths down to a minimum. We don't want to see what we saw in Italy and in New York. We it just became overwhelmed and people just start dying. We're trying to avoid that situation. And we can do so while we lead, as much economic activity as is possible. So it's not that the two are in conflict. We just have to learn to live with this virus and this viral threat.
Having said that, we heard from the Minister of Basic Education yesterday on the revised school calendar. We are told that the office-based staff are expected to return to work on the 4th of May. Teachers return to work on the 18th of May. And the proposal is that the grade 12 and 7 learners go back to school on the 1st of June. If all those health safety measures that the minister mentioned yesterday are put in place, are you comfortable as a medical professional with sending our children back to school during this time?
I have no doubt that we have to try and find a way to live with this virus. We have to accept that it exists as a threat, but we're going to have to get on with leading our lives as best we can. We have to mitigate the risks. But if people are thinking that they're going to be sending their children and there is not going to be any infection anywhere, then they're just mistaken. There's a risk of infection when you go to your local, grocery store. There's a risk of infection when you go anywhere. So whether you go to school, whether you go shopping, whether you go to your workplace, it carries a risk. The question that really should be asked is that, have I taken the steps to minimize that risk? Have I ensured that I keep my social distancing, I'm washing my hands, I'm sanitizing, I'm wearing a mask where it's crowded, I'm doing the things that I can to reduce my risk? The only people that I feel cannot simply go on the basis of reducing their risk is those who are above the age of 60. In fact, those who are above the age of 70, my advice to them is to really avoid everything possible, because even a small risk in that age group carries with it a significant risk of severity. Whereas in younger people, the risk of severity is much lower.
So, talk to us about that and what the data is suggesting. It seems that when the children contract COVID-19, they get less severe illness. That's my understanding of it. And that's what research is telling us. But, you spoke about these health protocols that need to be put in place in order for our children to get back to school. But when you're dealing with children, Professor, it's so difficult to keep them away from each other, especially the younger ones. Practically, how would that work?
I think we have to just simply go on the basis that we take the precautions in the school. There will be a small risk of a child coming in who either has very mild symptoms and has the virus and will spread it to the other children. The important thing about children is, as you pointed out, that children have a very mild form of disease. Quite unlike flu or other diseases where it's quite severe in children. In the case of COVID-19, it's a very mild condition. Children don't even know that they've got this virus. So we can either say that we won't send our kids to school until probably 2022 or somewhere like that, until we have a vaccine, which is not going to be anytime soon. Or we find a way in which we try to send our kids to school, live with the virus, and mitigate the risk. Now, when a child does expose other children in the class and the virus does spread, the concern is going to be mainly for the people back home. So when they take it back home, we have to try and ensure that children do not interact with their grandparents, because that's where the risk is going to be high. It's not, it's a manageable risk if you're talking about younger people. But the moment you start talking about those, over 70, the risk becomes much higher. And we have to avoid those children interacting with their grandparents. And I think if we can get that message across, then even transmissions that will occur in schools, we can't avoid it, that they will not have any significant impact in terms of disease.
All right, sir, it's so much to discuss, so little time. I guess probably the only chance that we have to get back to normal life is to get a vaccine. We're told that's still between 12 and 18 months away, but we're talking through the ways in order to mitigate the effects of the virus. Although nurses and doctors are on the front line, COVID-19 is a battle that needs to be fought by individuals, by families, and that's, I guess, how we will stem the spread of this virus. We thank you very much indeed, sir, for sharing your time and sharing your expertise. We'll chat to you soon. Be well.
Welcome.
All right, so that was the chairperson of the Ministerial Advisory Committee on COVID-19, Professor Salim Abdool Karim.